Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. This is 15 practice NCLEX questions. Without delay, let's get started.
A 17-year-old client at 33 weeks gestation diagnosed with mild preeclampsia is treated as an outpatient. The nurse instructs the client to contact a healthcare provider immediately if she experiences which of the following? 1. Blurred vision. 2. Ankle edema. 3. Increased energy levels. 4. Mild backache. The correct answer is 1. Severe headache, visual disturbances, such as blurred vision, and epigastric pain are associated with the development of severe preeclampsia and possibly eclampsia. These danger signs and symptoms must be reported immediately. Severe headache and visual disturbances are related to severe vasoconstriction and a severe increase in blood pressure. Epigastric pain is related to hepatic dysfunction. Ankle edema is common during the third trimester. However, facial edema is associated with increased fluid retention and the progression from mild to severe preeclampsia. Increased energy levels are not associated with the progression of the client's preeclampsia or the development of complications. In fact, some women report an energy spurt before the onset of labor. Mild backache is a common discomfort pregnancy, unrelated to progression of the client's preeclampsia. It also may be associated with bed rest when the mattress is not firm. Some multiparous women have reported a mild backache as a sign of impending labor. When preparing the room for admission of a multigravida client at 36 weeks gestation diagnosed with severe preeclampsia, which of the following should the nurse obtain? 1. Oxytocin infusion solution. 2. Disposable tongue blades. 3. Portable ultrasound machine. 4. Padding for the side rails. The correct answer is 4. The client with severe preeclampsia may develop eclampsia, which is characterized by seizures. The client needs a darkened, quiet room and side rails with thick padding. This helps decrease the potential for injury should a seizure occur. Airways, suction machine, and oxygen also should be available. If the client is to undergo induction of labor, oxytocin infusion solution can be obtained at a later time. Tongue blades are not necessary. However, the emergency cart should be placed nearby in case the client experiences a seizure. The ultrasound machine may be used at a later point to provide information about the fetus. In many hospitals, the client with severe preeclampsia is admitted to the labor area, where she and the fetus can be closely monitored. The safety of the client and her fetus is the priority. For the client who is receiving intravenous magnesium sulfate for severe preeclampsia, which the following assessment findings would alert the nurse to suspect hypermagnesemia. 1. Decreased deep tendon reflexes. 2. Cool skin temperature. 3. Rapid pulse rate. 4. Tingling in the toes. The correct answer is 1. Typical signs of hypermagnesemia include decreased deep tendon reflexes, sweating or flushing of the skin, oliguria, decreased respirations, and lethargy progressing to coma as the toxicity increases. The nurse should check the client's patellar, biceps, and radial reflexes regularly during magnesium sulfate therapy. Cool skin temperature may result from peripheral vasodilation, but the opposite, flushing and sweating, are usually seen. A rapid pulse rate commonly occurs in hypomagnesemia. Tingling in the toes may suggest hypocalcemia, not hypermagnesemia. Which of the following would the nurse identify as a priority to achieve when developing the plan of care for a prima gravida client at 38 weeks gestation who is hospitalized with severe preeclampsia and receiving intravenous magnesium sulfate? 1. Decreased generalized edema within 8 hours. 2. Decreased urinary output during the first 24 hours. 3. Sedation and decreased reflex excitability within 48 hours. 4. Absence of any seizure activity during the first 48 hours. The correct answer is 4. The highest priority for a client with severe preeclampsia is to prevent seizures, thereby minimizing the possibility of adverse effects on the mother and fetus, and then to facilitate safe childbirth. Efforts to decrease edema, reduce blood pressure, increase urine output, limit kidney damage, and maintain sedation are desirable but are not as important as preventing seizures. It would take several days or weeks for the edema to be decreased. Sedation and decreased reflex excitability can occur with the administration of intravenous magnesium sulfate, which peaks in 30 minutes, much sooner than 48 hours. Soon after admission of a preemie gravida client at 38 weeks gestation with severe preeclampsia, the primary healthcare provider prescribes a continuous intravenous infusion of 5% dextrose in Ringer solution and 4 grams of magnesium sulfate. While the medication is being administered, which of the following assessment findings should the nurse report immediately? 1. Respiratory rate of 11 breaths per minute. 2. Patellar reflex of +2. 3. Blood pressure of 160/88. 4. Urinary output exceeding intake. The correct answer is 1. A respiratory rate of 11 breaths per minute suggests potential respiratory depression, an adverse effect of magnesium sulfate therapy. The medication must be stopped, and the primary healthcare provider should be notified immediately. A patellar reflex of +2 is normal. Absence of patellar reflex suggests magnesium toxicity. A blood pressure reading of 160/88 would be a common finding in a client with severe preeclampsia. Urinary output exceeding intake is not likely in a client receiving intravenous magnesium sulfate. Oliguria is more common. After administering hydralazine 5 milligrams intravenously as prescribed for a preemie gravida client with severe preeclampsia at 39 weeks gestation, the nurse should assess the client for 1. Tachycardia, 2. Bradypnea, 3. Polyuria, 4. Dysphagia. The correct answer is 1. One of the most common adverse effects of the drug hydralazine is tachycardia. Therefore, the nurse should assess the client's heart rate and pulse. Hydralazine acts to lower blood pressure by peripheral dilation without interfering with placental circulation. Bradypnea and polyuria are usually not associated with hydralazine use. Dysphagia is not a typical adverse effect of hydralazine. A 16-year-old unmarried preemie gravida client at 37 weeks gestation with severe preeclampsia is in early active labor. The client's blood pressure is 164/110, which of the following will alert the nurse that the client may be about to experience a seizure? 1. Decreased contraction intensity. 2. Decreased temperature. 3. Epigastric pain. 4. Hyperreflexia. The correct answer is 3. Epigastric pain or acute right upper quadrant pain is associated with the development of eclampsia and an impending seizure. This is thought to be related to liver ischemia. Decreased contraction intensity is unrelated to the severity of the preeclampsia. Typically, the client's temperature increases because of increased cerebral pressure. A decrease in temperature is unrelated to an impending seizure. Hyperreflexia is not associated with an impending seizure. Typically, the client would exhibit hyperreflexia. A client at 36 weeks gestation begins to exhibit signs of labor after an eclamptic seizure. The nurse should assess the client for 1. Abruptio placentae, 2. Transverse lie, 3. Placenta accreta, 4. Uterine atony. The correct answer is 1. After an eclamptic seizure, the client is at risk for abruptio placentae due to severe vasoconstriction resulting in hemorrhage into the decidua basalis. Abruptio placentae is manifested by a board-like abdomen and an abnormal fetal heart rate tracing. Transverse lie or shoulder presentation, placenta accreta, and uterine atony are not related to eclampsia. Causes of a transverse lie may include relaxation of the abdominal wall secondary to grand multiparity, preterm fetus, placenta previa, abnormal uterus, contracted pelvis, and excessive amniotic fluid. Placenta accreta, a rare phenomenon, refers to a condition in which the placenta abnormally adheres to the uterine lining. Uterine atony, or relaxed uterus, may occur after childbirth, leading to postpartum hemorrhage. An obese 36-year-old multigravida client at 12 weeks gestation has a history of chronic hypertension. She was treated with methyl-dopa before becoming pregnant. When counseling the client about diet during pregnancy, the nurse realizes that the client needs additional instruction when she states which of the following. 1. I need to reduce my caloric intake to 1,200 calories per day. 2. A regular diet is recommended during pregnancy. 3. I should eat more frequent meals if I get heartburn. 4. I need to consume more fluids and fiber each day. The correct answer is 1. Pregnancy is not the time for clients to begin a diet. Clients with chronic hypertension need to consume adequate calories to support fetal growth and development. They also need an adequate protein intake. Meat and beans are good sources of protein. Most pregnant women report that eating more frequent, smaller meals decreases heartburn resulting from the reflux of acidic secretions into the lower esophagus. Pregnant women need adequate hydration and fiber to prevent constipation. After instructing a multigravida client at 10 weeks gestation diagnosed with chronic hypertension about the need for frequent prenatal visits, the nurse determines that the instructions have been successful when a client states which of the following? 1. I may develop hyperthyroidism because of my high blood pressure. 2. I need close monitoring because I may have a small for gestational age infant. 3. It's possible that I will have excess amniotic fluid and may need a cesarean section. 4. I may develop placenta accreta, so I need to keep my clinic appointments. The correct answer is 2. Women with chronic hypertension during pregnancy are at risk for complications such as preeclampsia, about 25%, abruptio placentae, and intrauterine growth retardation, resulting in a small for gestational age infant. There is no association between chronic hypertension and hyperthyroidism. Pregnant women with chronic hypertension are not at an increased risk for hydramnios, an abnormally large amount of amniotic fluid. Clients with diabetes and multiple gestations are at risk for this condition. Placenta accreta, a rare placental abnormality, refers to a condition in which the placenta abnormally adheres to the uterine lining. It is not associated with chronic hypertension. A client presents to the OB triage unit with a report of bright red vaginal bleeding that has saturated a peri-pad over the last hour. The nurse observed the fetal heart rate with a baseline of 130 decreasing to 100 for 60 seconds and then returning to 130. There are no contractions present. Which are the priority nursing interventions? 1. Ask client time of last oral intake and prepare to start an IV. 2. Continue to observe, monitor, and perform Leopold's maneuver. 3. Apply oxygen by face mask and perform sterile vaginal exam. 4. Place client in hands and knees position and call primary healthcare provider. The correct answer is 1. Because the woman is currently bleeding and the fetal heart rate is showing decelerations, the woman would need fluid replacement and a possible emergent cesarean birth. The woman may also need fluid volume replacement. The nurse can prepare for this by asking last oral intake, obtaining IV access. The client should be placed in a lateral position to enhance uteroplacental blood flow and given oxygen. The nurse should notify the primary healthcare provider as soon as possible, but the hands and knees position is indicated only if the client is experiencing back labor or umbilical cord prolapse. Leopold maneuver is done to determine fetal position in utero and would have already been done prior to placing the fetal heart rate monitor. A 24-year-old client, G3, P1, at 32 weeks gestation, is admitted to the hospital because of vaginal bleeding. After reviewing the client's history, which of the following factors might lead the nurse to suspect abruptio placentae? 1. Several hypotensive episodes. 2. Previous low transverse cesarean birth. 3. One induced abortion. 4. History of cigarette smoking. The correct answer is 4. Although the exact cause of abruptio placentae is unknown, possible contributing factors include excessive intrauterine pressure caused by hydramnios or multiple pregnancy, cigarette smoking, alcohol ingestion, trauma, increased maternal age and parity, and amniotomy. A history of hypertension is associated with an increased risk of abruptio placentae. A previous low transverse cesarean section and a history of one induced abortion are associated with increased risk of placenta previa, not abruptio placentae. When assessing a 34-year-old multigravida client at 34 weeks gestation experiencing moderate vaginal bleeding, which of the following would most likely alert the nurse that placenta previa is present? 1. Painless vaginal bleeding. 2. uterine tetany. 3. Intermittent pain with spotting. 4. Dull lower back pain. The correct answer is 1. The most common assessment finding associated with placenta previa is painless vaginal bleeding. With placenta previa, the placenta is abnormally implanted, covering a portion or all of the cervical OS. Uterine tetany, intermittent pain with spotting, and dull lower back pain are not associated with placenta previa. Uterine tetany is associated with oxytocin administration. Intermittent pain with spotting commonly is associated with spontaneous abortion. Dull lower back pain is commonly associated with poor maternal posture or a urinary tract infection with renal involvement. Following a cesarean birth for abruptio placentae, a multigravida client tells a nurse, "I feel like such a failure. None of my other childbirths were like this." The nurse's response to the client is based on the understanding of which of the following? 1. The client will most likely have postpartum blues. 2. Maternal-infant bonding is likely to be difficult. 3. The client's feeling of grief is a normal reaction. 4. This type of birth was necessary to save the client's life. The correct answer is 3. Feelings of loss, grief, and guilt are normal after cesarean birth, particularly if it was not planned. The nurse should support the client, listen with empathy, and allow the client time to grieve. The likelihood of the client experiencing postpartum blues is not known, and no evidence is presented. Although maternal-infant bonding may be delayed owing to neonatal complications or maternal pain and subsequent medications, it should not be difficult. Although the nurse is aware that this type of birth was necessary to save the client's life, using this as the basis for the response does not acknowledge the mother's feelings. The nurse who is caring for a client with kidney failure notes that the client is dyspneic, and crackles are heard on auscultation of the lungs. Which additional signs/symptoms should the nurse expect to note in this client? 1. Rapid weight loss. 2. Flat hand and neck veins. 3. A weak and thready pulse. 4. An increase in blood pressure. The correct answer is 4. Impaired cardiac or kidney function can result in fluid volume excess. Findings associated with fluid volume excess include cough, dyspnea, crackles, tachypnea, tachycardia, an elevated blood pressure, a bounding pulse, an elevated central venous pressure, weight gain, edema, neck and hand vein distension, an altered level of consciousness, and a decreased hematocrit level.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.